World Health Organization says people may be sick with the virus for 1 to 14 days before developing symptoms. The most common symptoms of coronavirus disease, that is COVID-19, are fever, tiredness, and dry cough. Most people, about 80% of them, recover from the disease without needing special treatment. More rarely, the disease can be serious and even fatal. Older people and people with other medical conditions such as asthma, diabetes, or heart disease may be more vulnerable to becoming severely ill. These symptoms of cough, fever, and tiredness are so common in this season here in Japan that it's hard to predict that is it a symptom for real coronavirus or is it a usual affair? And this can happen with even one of our close friends or family member too. So what do we do in such situation? Yes, we can call hotline, but we might not qualify for the PCR test yet. The time lag between you see these symptoms and you get an okay for PCR test becomes crucial. On the other hand, we also hear that these soft lockdowns will continue for some time here and the rest of the world. So we might have to anyways learn to live with this and also be able to contain this on our own levels to whatever extent we can. In such situations, we ourselves have to take precautions at home and to prevent this spread. Ministry of Health, Labor and Welfare of Japan has given 8 points common sense guideline to handle such situation. It recommends these steps when one of a family members is suspected to have novel coronavirus infection. Let us see what are these 8 steps. First one is segregate the rooms. The infected person should be placed in a own room. Avoid sharing one room with the infected person when eating and sleeping. Even if you cannot separate the infected person's room, living space with other rooms due to the needs of childcare or space capacity, keep a distance of at least 2 meters away from the infected person. Also use partitions and curtains, etc. If there is a case to sleep in the same room, sleep with both heads staggered. The infected person should avoid going to other rooms or living space. Number 2 is limit persons responsible for caring for infected patients as much as possible, especially people with disease in heart, lung or kidney, people with diabetes or reduced immunity, pregnant women, etc. should avoid taking care of the infected person. Number 3, wear a facial mask. The used mask should be immediately thrown away without taking it to another room. Do not touch surface of used mask. Remove it by pinching off the rubber or string. After removing your mask, always wash your hands with soap. Alcohol disinfectant is also effective. If your mask gets dirty, immediately use a new, clean, dry mask. If you don't have a mask, cover your mouth and nose with tissue, etc. when coughing or sneezing. Number 4, ventilate the room. Regularly ventilate the rooms. Keep open windows as well as the rooms where other family members are. This is more for the other family member than the infected person themselves. Number 5, disinfect shared surface that touched by hand. Wipe the shared parts, the door handles, knobs and bed fences with diluted household chlorine bleach. Then wipe them with water. The virus survives for a while on objects. Confirm the main component of the household chlorine bleach is hypochlorite. Then adjust its concentration to 0.05%. For example, if the concentration of the product is 6%, add 25 ml of the liquid to 3 liters of water. Next, clean toilets and bathrooms frequently. Use a common type of household detergent and after rinsing, disinfect well with a household disinfectant. Towels, clothing, tablewares, chopsticks, spoons, etc. should be washed as usual. No need to wash separately any clothes the infected person used. Do not share the one before cleaning. In particular, make sure towels are not shared in toilets, washrooms, kitchens, etc. Next point is wash dirty linen and clothes. Since the virus may be detected in fishes also, use gloves and masks when touching clothes and linen contaminated with bodily fluids. Also wash them by a laundry machine with a common type of household detergent and dry them completely. Seventh is dispose of garbage in a sealed bag. Put used paper tissues in a plastic bag, then seal them when you take them out of the room. After that, wash your hands immediately. Number 8, last but not the least, wash your hands often. Each family member should frequently wash their hands with soap and disinfectant with alcohol. Do not touch your eyes, nose, mouth, etc. before washing your hands. Apart from these 8 steps, there are additional 2 things. The infected person should avoid going out. Family members and those living together should monitor your own health by measuring fever, etc. and avoid unnecessary and urgent outgoing. Do not go to office, etc., especially if you have symptoms such as coughing or fever. Apart from these 8-point step and additional 2 points, there is a special guideline which is quite famous here in Japan, which is also referred as 3 C's. So what are those 3 C's? So the first C is closed spaces with poor ventilation. Second C is crowded places with many people nearby. And third C is close contact settings such as close range conversations. So the government has strictly said to avoid these 3 C's. The risk of occurrence of the cluster is particularly very high when these 3 C's overlap. So avoid anything which takes you closer to any of these C's, and also avoid things which actually encourages the overlapping of these 3 C's. So to summarize, here is the 8-point list of precaution to be taken at home if someone is suspected of the novel coronavirus. So first one is segregate the rooms. Second one is limit the person responsible for caring for infected patient as much as possible. Number 3, wear a face mask. Number 4, ventilate the room properly. Number 5, disinfect the surface. Number 6, wash dirty clothes with your gloves and mask on. 7, dispose the garbage in the sealed bags only. And number 8, wash your hands often. Then we saw the 2 additional points to avoid going out and monitor your own health. And then in the end, the most important, to avoid those 3 C's and its overlap. Those 3 C's are closed spaces with poor ventilation, crowded places with many people nearby. Number 3 is closed contact settings such as close range conversations. If you liked the video, do not forget to share with your family and friends you care about. And do not forget to visit IndoJapanPulse.com for similar useful and important information in India and Japan context. Thank you.